Hi everyone, welcome back to my YouTube channel. I hope you are well today and I hope you are taking good care of yourself. If you are new, welcome. My name is Regina. Today I'm going to talk about treatment for back pain. In the last video I did the causes, the symptoms and diagnosis. So in this video I'll be covering the treatment and preventive measure. The treatment I'm going to cover in this video should not be a substitute to your doctor's advice or the medication he or she is going to give you. And all the drugs I'm going to mention, you should not use it to practice self-medication except over the counter. And while purchasing over-the-counter medication, make sure you allow the pharmacist who is selling the drugs to direct you on the dose so you will not overdose yourself. Self-medication is not good. Back pain are treated with analgesic, like non-steroidal anti-inflammatory drugs. These are just symptomatic treatment. Like I said earlier, if your back pain is just acute, you don't need that much treatment like taking other potent analgesic like morphine or codeine. But for those who have chronic back pain, the drugs used in treating them are one, analgesic like non-steroidal anti-inflammatory drugs like aspirin, aceclofenac, ibuprofen, naproxen. This class of drugs are used for the treatment of back pain. But remember, you can't take this drug for a long time. Remember in the video of peptic ulcer, non-steroidal anti-inflammatory drugs is one of the causes of peptic ulcer. So you can't engage in this drug for a very long time. You can only take it for a specific time. And if it doesn't fix it, then they can administer more potent drugs like codeine, morphine, or anti-inflammatory drugs like cortisone. That is usually given by IV, that is intravenous. So apart from this medication, another treatment option or another treatment method that you can include while taking the medication is physiotherapy. Like if you go to the hospital and you are diagnosed with chronic back pain, they will send you to physiotherapy to give you some exercises and also do some treatment using electronic device to stimulate or try to massage the back. Chiropractor, they will use their hands to fix or feel the spine. They will use their hands to feel the structure of the bone, including the spine, and then they will help to fix it. Another method is acupressure. It's just like physiotherapy, using some electronic device to massage and try to fix the problem of the back. So another treatment method is traction. This is method of using pulley and weight to stretch the back. Another method is cognitive behavioral therapy. So in this method, the person who is suffering from back pain is taught another way of thinking. They will be taught how to think so that their pain perception will be less. They will have different view about pain. Another method is exercise. Is included. See, if you don't do exercise, just depend on drug. Sorry. Drug is only there to control the pain. But for you to live a normal life and have less pain, you have to include exercise in your day-to-day life. Even if drug happens to control it, it has side effects. Is it non-steroidal anti-inflammatory drugs? Chronic use of it will result in ulcer, or is it narcotic drugs like codeine, morphine? That is habit forming, and the doctors cannot prescribe it for a long time. It's just for a short time. Exercise is very, very important. I advise you check through the YouTube video to know the exercise that you can do. But if you have undergone surgery for your back, then don't just engage in any kind of exercise. You should always consult the healthcare, your doctor, your orthopedist, or your spine surgeon to know the kind of exercise that suits you. Don't engage in any kind of exercise. It might be very dangerous for you. I know there will be many exercises on YouTube that might even be confused. You won't know which one will work for you. So for that reason, I'll be covering a video on the exercises and the things that have helped me so far for my back pain. Another treatment option, and that is the last one, is surgery. That should be the last option, because Even if surgery fixes the pain now, there is no guarantee that in 5 to 10 years time that you will not have the pain back. And this spine surgery is only carried out in emergency case, like where the person cannot walk properly because of the pinching of the nerve, or there is compression in any part of the muscle of the leg or buttocks, or loss of bowel movement control or loss of bladder control. That is when surgery will be needed. And in this surgery, there is 3 options. Number 1 is fusion. Another option is artificial disc. That is, if disc is the problem, they can remove that disc and use artificial one to fix in there, to fill in the gap, just to stabilize the spine. And another option is discectomy. In this, if the problem is due to bulging disc or disc herniation, the spine surgeon will try to cut the part of the disc that bulged out so that it will stop pinching the nerve. And after the surgery, the person will become okay. So apart from this treatment, now I'll talk about the preventive measure, like how you can prevent back pain. And also, if you are having back pain, you can practice this. Number 1 is you have to practice exercise, include exercise. Example, after having a stressful day, they come back being stressed. If you can do at least 20 to 30 minutes exercise or stretching, no matter how stressed you are, you will feel so better at the end of the exercise. You feel relief. Another step is improving your posture. Yes, it's very important. Like I said earlier, we forgot about our posture. We sit and stand anyhow we want, not minding if our spine is in good position while standing or while sitting. So if your work includes sitting for a long time, maybe typing something on the system, you can get this kind of chair. And sometimes when you try to rest your back, you realize that your upper back has bent, like it have bent, and it seems like this back side bulged out. That posture is very, very bad. So instead, try to sit up like this. This is normal posture. You should sit, not like this. But this is how we normally sit when we are doing something, including myself. So try to improve your posture by sitting like this. If you have this kind of chair and resting your back on it like this will cause back pain, get this kind of stuff and put on it. If you can't get it, use pillow. You can sit like this, then put pillow in this space and rest your back on it. And even if you don't have this kind of chair, if you have any other chair with back or plastic chair or any other chair, you can use pillow or this stuff here to put on it, so that when you sit down, sitting like this, your back will still rest, so you won't have to bend like this. And also, if you are walking, don't walk like this. Just be conscious of your posture. And we've made it an habit that if you try to position in the right way, you feel uncomfortable or even have some kind of pain and discomfort. So make it a habit, like practice it. With time, you feel that, oh, this is the best way to sit and this is the best way to stand or put your spine. So another option is change your mattress. Like get a mattress or foam that will support and straighten your spine. Don't sleep in a mattress that will have dip, and when you are sleeping all night that you're supposed to be resting, you are even breaking up your spine anymore. If you can't change it now, you can get clothes or something to fill in that dip or that depressed area on your mattress, and make sure it's straight before you lie on it. And also, when we are sleeping, sometimes when you lie down, you find that there is space here. If you try to put in your hand, you feel space here between this side of your body, between your side and the bed. So in that case, you can get cloth or pillow or blanket or any thick cloth and put it in between. Just to make sure that while you are sleeping, you are not stressing or breaking your spine in one way or the other. So apart from this, make sure you include vitamins in your diet. If you can't get enough vitamins in your diet, you can get supplement. Another thing is avoid lifting heavy load, something that is very heavy for you. If you are a mother and your child is helping you, try to gauge their age and the kind of things they carry. Don't let them carry something that is bigger than them, because this might not have effect on them now, but in nearby future it will. Don't let them carry something that is heavier than them, or maybe your work includes carrying heavy load. Find a way to help yourself from carrying something that is heavier than you or straining your back so much. So apart from this, if you have back pain, taking treatment, also try to use a hot water pack or ice pack at the area of the pain. You can get something like this, hot water pack or hot water bag, then boil water and pour inside it and cover it so it have cover, and cover it, and then try to put it at the area of your back, that is paining. Don't put it directly on your skin because it will burn you. Try to put clothes on your back so that you won't have direct contact with this, and then put this on your back for like 15 to 20 minutes. This will really help to improve back pain that involve inflammation and tingling sensation, because when it does that, it will increase blood flow in that area and then limit inflammation. And also you can use cold, like ice pack. You can pour ice inside this stuff and then put it on your back or area of your back that is paining you. Make sure you drink water enough. Drink a whole lot of water. About 60% of our body is made up of water. Our cell needs water to survive. Maybe you are someone like me that doesn't like drinking water. Don't wait to be thirsty to drink water. Drink as much as you can. Drink nothing less than 3 liters of water every day. So if you know about any cure for chronic back pain as a result of degenerative disc disease or herniation of the disc or bulging of the disc that will help to fix it back and the back become normal, please comment on the comment section below so that people will not engage in spine surgery, because it's really risky. Just comment on the comment section below so that others will learn also, and let's help each other. So this comes to the end of this video. I hope you enjoyed this video. If you do, give me a thumbs up and share to your friends and family. Let's take care of our spine. Do have yourself a good day. Bye bye.